Hi, everyone. This is Caroline from Fiat Integrative Health in Franklin, Tennessee, and you're listening to the Fiat Health Podcast. We believe that now more than ever, the healthcare industry has become a place of confusion. And over the years, we have been asked countless questions about what true health and integration for the whole person looks like. Join us every other week as we explore topics ranging from primary care and women's health to counseling and spiritual health. We're so glad you're here. Hey, everybody. Welcome back to the Fiat Health Podcast. I'm Caroline Hartley, family nurse practitioner, and I'm joined today with Jenn Ragusa.
That's me.
Yep.
So I didn't get any calls for my professional voice. So here I am back on the podcast.
Maybe this time someone will pick you up with your amazing radio voice. I love it. Okay, so today we're just super stoked to talk all about poop.
That's right. Potty talk.
Yes, we're going to talk all about constipation specifically. Going to go through all the ages and stages and hopefully give you some pointers of things to look out for and what you can do to help. So I think we'll just first jump right in and talk about what exactly is constipation.
Yeah. So constipation is a condition where we're not pooping often enough, or maybe it is difficult to do so. So maybe somebody does poop every day, but it's hard, or it's a certain consistency that's difficult. Or sometimes kids are so constipated that they actually just poop liquid.
Mm-hmm. Like usually that's when it's like streaks in the underwear. It's when you're super
or
constipated.
Having accidents. Mm-hmm. For someone who used to not have accidents, then that usually is a red flag of constipation.
Mm-hmm. Yeah, I'd say anytime you see dry, hard, rabbit poop, pellet-like poop, hard poop in general, that would qualify as constipation, as well as just difficult to pass. So, especially in your kids, if you see them like red-faced, grunting, or, they're telling you when they're going to the bathroom that it hurts, definitely all signs of constipation.
I also think this is something to be mindful of as your kids are getting older, because, older kids don't necessarily need help in the bathroom anymore. Like when they're little and they have their little, T-Rex arms and they can't wipe their hiney, like you're there and every day that they've gone to the bathroom or not.
Uh-huh.
But, as they get older and more self-sufficient, just keep an eye out. Make sure that you're noting that or having a code word that your kid says when they come out of the bathroom. I think that's important because, we're going to ask you at your well child. Hey.
Yeah. Yeah. I mean, definitely it should be a kind of a normal, I don't want to say dinner table conversation.
Sure.
But
maybe at our house.
Conversation around the house of just like, kids should know that it's ideal and healthy to poop every day. And if they're not pooping every day, they should let you know. And so, yeah, definitely the goal for adults and kids is, like I say, everybody but the infants and newborns, they're in their own category, but is to poop once a day, soft. Twice a day is great. And we're not going to talk about like abnormal stool in terms of like diarrhea or, loose stool. We're not going to get into that. We're specifically focusing on constipation today. So let's talk about kind of the normal pattern. So we just talked about normal pattern for adults, but for newborns, just something to be aware of for anybody who's first-time parent expecting. All newborns poop many, many times a day. So many times.
You change diapers overnight.
Yeah. And so, when they first come out of the womb, they have meconium, that black, tarry, sticky kind of poop. And that usually lasts like 3 to 5 days. I mean, 5 is pretty long. Yeah. Once milk comes in or the baby's getting colostrum, it kind of transitions to more of a green color. And then the expected yellow, soft, seedy, almost with every feeding pretty much.
Do you know what the seeds are about?
Mm-hmm.
Yeah. Most people don't know what the seeds are about. So seeds are just fat. And so it's just excess fat that the baby couldn't consume. So I thought that was really interesting.
Mm-hmm. Yeah, totally. It's a great sign.
Yeah.
And then, so that's typical newborn. And then obviously once we reach 6 months-ish, we start introducing solids. And sorry, backtrack on that. Newborns pooping multiple times a day, almost every feeding, usually around 2 months is when that starts to slow down. 1 to 2 months, maybe a little bit later, where you're starting to see poop once a day. Sometimes we're going to skip a day, and we'll talk about kind of signs to look for if things look abnormal. But I would say every 1, 2, or 3 days is totally normal in infancy, especially a breastfed baby. Anytime you've got a formula-fed baby, they should be pooping every day. like no questions. And then once we move to about 6 months old, with the introduction of solids, it's really important to make sure they're pooping every day at that stage, which kind of brings us to our next little topic here of when is it the most common that we see constipation? And so the first time we typically see constipation is the introduction of solid foods.
Or I would say if it's early, like breast milk to formula transition.
Mm-hmm.
If it's earlier.
Mm-hmm. Yeah, that's common too, for sure. Formula can be constipating. And so just keeping that in mind. And then after that, it would be about 6 months, 7 months, we start introducing foods. It's really common to start seeing constipation come in. And then after that, when you start potty training, also common to see constipation there. Maybe you can speak a little bit to why that happens and kind of the vicious cycle that can happen with that developmental stage.
I mean, what was my opinion?
Always. I love your opinion.
I think there's a lot of independence, right?
Mm-hmm.
We were talking about that at lunch. Like, the independence factor, like I can choose if I'm going to do this or not.
Mm-hmm.
And also I feel like they're pretty choosy with food.
Mm-hmm.
So, kids start to really, in those toddler preschool years, oh, I like this. Oh, I like that. Oh, I don't like this. I don't like that. And so it's when we see our increase in dietary changes.
Mm-hmm.
And also just like drinking like real cow's milk
mm-hmm.
and cheese. Oh,
Mm-hmm.
who doesn't love cheese? Love me some cheese. But it's constipating.
Yeah.
So I was talking to someone today about that. And maybe, it's just something you should have like kind of a limit of how many times a week you're using, cheese per se. Because kids will just eat cheese for every meal.
All the time.
I mean,
so good.
I probably would too if I was allowed or allowed myself.
And I think too, with the potty training, just like you're saying, like kids having independence, there is commonly, I'd say, like a fear factor that sometimes arises where kids are afraid of the potty. Like you're trying to potty train them and maybe they will pee on the potty, but like pooping on the potty is like major mental block.
I think worse so though if they have harder stools. If their stools are easy, I think it's not as big of a deal.
I agree. Yeah. If we can keep the stools easy to pass, then it becomes less so. But we'll see in the clinic, the vicious, this like worst case scenario, like you get the 2 or 3 year old who has now associated pooping with pain. And so they are now withholding, and which creates more pain and constipation. And so it's just a really difficult cycle to break, really, really difficult. And so if we can avoid that up front, by keeping the stools nice and soft at the get-go, especially when potty training, that is huge.
And also remember the anatomy of children. So it's one thing, an adult toilet, they have nothing to put their feet on.
Yeah.
And so, especially at the beginning when they're really young, like a small potty next to the potty makes more sense.
Mm-hmm.
But we're in that transition in my life right now where it's like, okay, we need to get over these tiny potties because we're also making a mess everywhere. But in the same breath,
those tiny potties.
They have it's a squatty potty.
Yeah. Mm-hmm.
It's a built-in squatty potty. So how do you make a built-in squatty potty with a big toilet? Someone let me know.
Yeah.
But, my kid's pooping fine, so it's not a big deal. But just think about that. You may need to be on a tinier potty for a longer period of time because, a physical therapist would tell you that this is an important way for them to poop and to be able to do that. Because they want to go in the corner when they're super young anyways because they want to squat.
They want to squat. Totally. Another common time that we see constipation is when kids start going to school.
Mm-hmm.
I think it's hilarious because I have 4 kids who are in full-time school right now. And as soon as we get home, within half an hour, all 4 of our bathrooms are occupied.
You have 4 bathrooms. That's
I know,
rad.
right? Which is crazy. It's a good thing we do, I guess.
Yes, exactly.
Because they've all held their poop until they got home. And so obviously super common for kids not to want to poop at school. And so they hold it, which can lead to constipation. And then...
And you can do bowel regimens. I mean, it's something they preach big time in hospitals is like, you can kind of just teach yourself when to poop.
Mm-hmm.
I mean, you can go, sit them in the morning and give them a book and see if, you can kind of stimulate the bowels to do what they need to do after breakfast.
Sure. Well, and like, in my kids' instance, they're not constipated.
Oh, exactly.
They're not withholding necessarily through all of school. Right. They have nice soft stools every day when they get home from school. But, you may not notice your kid goes 3 days
totally
pooping or something. Okay. So we're going to talk through some tips and tricks of how do we prevent constipation, kind of some normal things we can be doing every day. And then how do we treat constipation here at our clinic, and some things that you can hopefully use at home as well. So the first most obvious thing is, increase your fluid intake.
Mm-hmm.
So with kids, you want to be doing, I think the general rule is like half their body weight.
In ounces.
Mm-hmm.
Mm-hmm.
Yeah. So if they weigh 30 pounds.
At least 15 ounces.
At least 15 ounces.
And then your kids, so.
Mm-hmm. Yeah. Some kids are huge drinkers. Some are not. If, you need to add a little bit of prune juice, or which we'll get to a little bit later, or pear juice or something too, just to make it a little bit more appealing.
And you can do flavors. I mean, flavors within reason. Like, I don't want all of their fluids to be sugar, but if they will do bone broth, or if they will do other, coconut water, that kind of stuff, it doesn't have to be strictly water, but the majority of it should be water.
Yeah, for sure. And I'm not a big water tracker. I have no idea how much water my kids take every day. But if they were constipated, I would start keeping a little kind of log so that I could tell and make sure, okay, we are getting enough, or are we not? We need to push for it a little bit more.
Absolutely. Adults are the worst with getting water. I can tell you that from my own experience. I'm like, oh, when's the last time I grabbed my water bottle?
Drink water?
Yeah, for sure.
100%. Okay. And then the other really easy thing you can do is just increase fiber in your diet. So fiber just helps bulk stools up, which reduces constipation. And so what you'll want to do, just some common foods you could add in: chia seeds. I know flax seeds in my own family has been super effective. Just get some flaxseed, put on oatmeal.
Yep.
Oats, berries, pears, apples, sweet potatoes, quinoa, barley, avocado. Obviously, it's an easy Google thing too. High fiber foods. And then something else just to think about is when you do decide to potty train, just make sure that the child's showing readiness is another way to kind of prevent that potty training constipation, is that it shouldn't be a stressful event. So, if they're getting really stressed out about it, again, I would just probably back off and wait a little bit longer. They're not quite ready. Okay, let's talk about troubleshooting constipation. What would you say for just newborns who seem to be constipated? And when I say newborn, I mean 0 to 2 or 3 months. What would you say?
I mean, first I would just start with something really basic, like, gentle rectal stimulation. I mean, if you have a rectal thermometer, perfect. Because especially those little, particularly, I'm not an advocate for any kind of product, but the Frida Baby is just a really short little.
Or the Wendy's.
The Wendy's, that's also Frida Baby as well. And those are basically like gas relievers, but they stimulate that rectal sphincter. That's something you can do very easily. When I used to be inpatient and I did some emergency room work, that would be the first thing. Kids would come in, constipation. Oh my gosh. I'm like, oh, well, I'm just going to go ahead and take a rectal temperature.
Done.
And that was it. It was the quickest visit in the books. Doc basically didn't even have to come see them. And then my other thing that I really like and has been effective in my house is Epsom salt baths. So, a quarter to a half of a cup of, unfragranced, very basic Epsom salt in a child bath, because they're too big or too little to sit in anything.
Yeah, the infant bath.
Definitely. And then obviously any kind of belly massage. So these are all very non-invasive. I'd say the rectal stim is the most invasive, but it's not really super invasive. As long as you, have something that's can't go too far.
For sure.
Per se. So those would be my first 3 things that I would start with.
And I'd say any newborn, if you have a newborn who hasn't pooped in a couple days, 2-3 days, I would definitely be reaching out to your primary care provider, because there's other things to consider,
Absolutely.
Especially in the very initial stages of feeding, you have to think what comes in must come out. And so if a baby's, certainly you can be kind of just plugged up in the newborn stage, especially with that meconium. A lot of times it's it does just take a little bit of rectal stimulation, get everything moving along. But sometimes it's that the baby's not eating enough. And that's one of the indicators, is that they don't have enough stool. So
they're absorbing all the calories from breast milk or formula. Usually this is more in our breastfeeders, but they're absorbing all the calories, therefore they're not pooping. So they need even more calories than what they're getting, because it is the excess, right? You're stooling out waste. And so kind of think about it as a calorie counter almost in the newborn period.
Yeah, in the newborn period for sure. And you can see breastfed babies, their stools will slow down in that, around that 2-month mark. But even then, typically, you do have kids who do fine going, up to 5, even maybe 7 days. But I would say after 3 days, I'd be doing a little belly massage, some bicycle kicks, rectal stimulation, make sure they're not uncomfortable. Yeah, checking in that stage. Okay, other things that we can do. So specifically, we're talking right now about infants. So moving from newborns now into like, let's say that 3 to 6 month range, like before we're even introducing solids, but we're not a newborn anymore. Like Jen said, belly massage, bicycle kicks. Definitely you can start with daily probiotic. I'd say, at this age, one that I typically recommend is the BioGaia, which is an L-reuteri strand, just because it's been studied in colic. It's been studied in infancy a lot. Another one we commonly recommend is the Plantophilus.
Lactobacillus plantarum.
Mm-hmm. And then
you don't need to throw like 20 billion strands.
No.
You don't need to throw a bunch of bacteria at little people.
Well, and
sometimes just a strand or so can make a difference.
I mean, any probiotic that you buy, if it doesn't say that you can use it in an infant under the age of 6 months, then you shouldn't be using it without consulting someone first.
Yeah, absolutely.
Chiropractic care can be really great for constipation.
There's some, misalignment, and that can definitely be helpful. Even herbal tinctures. I know particularly, and again, I don't advocate. I don't have any
affiliations.
Earthly Wellness has an actual herbal tincture that's like for infant belly relief, and it's down to zero. So you could use that. I mean, it's always nice to have something in your back pocket when you're a parent, because you don't know when it's going to happen. And usually constipation happens over time. So,
yep. And then another thing you can start right around 2 months is prune juice. And so you can do a 1-to-1 ratio, 1 ounce of prune juice, 1 ounce of water. You can put it in a bottle. You can do...
Make sure it's 100% prune juice. So no like ads or anything,
no sugar,
like Whole Foods or Sprouts, or make sure it's that more
juice.
Fancy. It's going to be a little more expensive. It's not going to be $4. It's going to probably be $8, but you're not going to use it forever.
Yeah, totally. And you can do, my kind of rule of thumb is like as many ounces as months is kind of the max. So like 2 ounces for 2 months, 3 ounces for 3 months in terms of throughout the day. Like kind of nurse on it throughout the day.
I would prefer it to be warmed. I definitely don't want it to be cold, but if it can be warmed a little bit, because just think about everybody's morning coffee. Whoop, ready to go, or tea or whatever you drink, right? You're ready to go right after that. So, I mean, think about that for a baby.
Yeah.
And you're stimulating that gut to get moving.
Yeah. And they'll probably more likely take it if it's warm.
Yeah.
That's all they ever know. Okay. And then something to consider as we move into eating solids, as we move into toddlerhood, even like 6 to 24 months, like we talked about before, increase the water, increase the fibers. Absolutely first step if you haven't done that already. Eliminate dairy. So we talked about that. Limiting sugar and gluten is not a bad idea, especially if we're dealing with, again, that cycle of withholding and painful stools. And then, you can add prune juice, but you could also consider doing purees. So if you're in that stage of, at the 6 to 9 months and doing purees, you could do apples, prunes, or pears. Apple sauce even can be helpful, but those are just some little things you can do for that age group. And then what would you say, maybe some other things that we can do, really starting at 2, I would recommend these things all the way through adulthood, really. It just changes how much you do.
Absolutely. So, I mean, you just keep doing your Epsom salt baths throughout this time. Magnesium, that's a big one.
Yeah.
Magnesium can be real helpful. And, you can do something over the counter. It's a little, at least some like the Calm Vitality and stuff, that's a little tart. So I don't know how that would go over, but I'm sure there's like chewables or something like that. You can do vitamin C up to like 3,000 daily. Think about when your provider talks to you about vitamin C, they always say try to titrate to bowel tolerance. It's because if you get too much vitamin C, you can start to have diarrhea. So, I think 3,000 milligrams a day is going to be reasonable, and see if that's helpful. And then, there are herbs. Senna is one of them, and that's actually something that, Western medicine uses a lot of, like a Senna tablet, but you can use it in tea, or I'm sure that Sprouts has some kind of tincture or capsules or something like that. But don't underestimate like the power of tea. And then it's warm, and you can make it like a little fun little daily ritual, and even tea time for kiddos who are at home. And it can be pretty concentrated the longer you seep, right? I mean, it'll give you instructions on any kind of tea bag, but there's some good versions at stores, but then there's plenty of people who are doing their own tea making. That probably have digestive support. I feel like that's one of the big, between respiratory support and digestive support, like teas definitely advertise that.
Yeah, for sure. Yeah, I'd say those are all like first line things. And then, there are over-the-counter medications you can move into that, I would do alongside with your PCP. There's things like Miralax and
For a short duration.
yeah.
No long-term Miralax using, please.
No long-term anything.
Yeah, that's true. But if you're at a traditional pediatric office, Miralax is just an indefinite solution, and it's not for a lot of reasons, but it's not an indefinite solution. So if you are on Miralax and you've been on it for a while, just please ask for more.
Yeah, absolutely. And then I do want to touch on this last part here on a constipation clean out. So this really applies to people who have been seen by their primary care provider and they are like, you need a complete clean out. You are so constipated, you're impacted maybe. So if you don't want to listen to this, now's the time to turn it off. Or maybe this is, I sent this to you to help walk you through how to do this. But this is really, again, in cases of impaction. And so what happens is, again, this is particularly in kids. I'd say you don't see this a lot in adults. I mean, I know it can happen, but the stool becomes so impacted that it just can't even pass, and it's just sitting there in the colon. And so the child will still be maybe having stools every day. They may even be soft, but there is still a retained stool in the colon. A lot of times these kids will come in with intermittent abdominal pain. That's kind of unexplained. Maybe even they are having urinary accidents when they didn't before, starting wetting the bed again when they weren't previously. Or if you have streaking in the underwear, that's a big, big sign of impaction. And so what you have to do is a complete clean out, colonoscopy prep. So how do you, what would you say? How do we start this out?
Well, it depends upon, what you've tried already, but you certainly, people can be effective with this with magnesium.
Totally.
You could use magnesium instead of Miralax. I think, the first thing everyone thinks of is going to Miralax because that's what they use for a colonoscopy clean out. But I certainly would start with magnesium, especially if you're not using that regularly presently.
And I would say, I always advise patients, you want to be home for a solid 3 days, probably.
For everyone's comfort.
Yeah, for everybody involved, because what you're doing is just, inducing a lot of bowel movements to the point to where the stool should come out clear, hopefully. I mean, at least fully liquid. We're passing a lot of stool. And this can actually be also used in kids who are afraid of the toilet. So maybe they're not even constipated, but if you can stimulate multiple bowel movements in a day, it kind of helps with that psychological, fear, basically exposure therapy.
Yeah. And I would say just, do that based on how bad the situation is.
Yeah. But so you'll want to take a couple days, magnesium first. Now, the downside with magnesium I found compared to Miralax is it's just not as surefire.
Sure.
So a lot of times you're oh, we gave magnesium, nothing's happened. We gave more magnesium, nothing's happened. We gave more magnesium. And then there's whoa, abdominal cramping, explosive diarrhea kind of thing. It's a little bit harder to titrate, I've found. So it's definitely go, slow and low kind of you don't need to just keep downing it. Where Miralax is kind of a little bit more surefire. You're going to get the response that you're looking for. You're not typically going to see abdominal cramping in Miralax.
I haven't heard of it. I mean, it is a side effect, but I've never had much experience with that.
No. And then, like we talked about earlier, you can have magnesium and then you can actually add on vitamin C on top of it.
Sure.
Too, as another option and then there might be times where it's okay, now we're going to add on Miralax on top of that. But this is definitely done, I would say, with a provider.
So you can have someone to hold your hand so that when they have that explosion after you've increased the magnesium, you're not oh my gosh, I'm doing something wrong.
No, totally. And so the whole goal though is to, have the clear stool. So we're totally cleared. Now, this is the hardest part is that that's not the end, that you clear out the stool for a child that's been impacted. And then what has happened though is their colon has stretched and it's been stretched probably for a little while to where the nerves aren't communicating very well, to where a lot of times kids are I didn't even know I needed to go to the bathroom. They start having stool accidents but the reality is they don't have the sensation that they need to go. And they don't
have the sphincter control because their sphincter's been stretched.
Yeah. So that all takes, 3 to 6 months.
Yeah. And that's why they really, they do say that constipation, like severe constipation, can really cause like PTSD for kids.
Oh my gosh. Yeah. It's so hard.
And and we have good recommendations there are physical therapists that work with this in children.
Oh yeah.
And so don't think that there is not help or hope or there is not more support.
Mm-hmm.
There is, because a good pediatric physical therapist can treat constipation well and get your kid back to where they should be.
Totally. And like teach them little things,
Yes.
Sometimes it's just the way they're sitting when they're watching TV.
Yes.
That's really like kinking things, and they need to stretch. They do these exercises. So, absolutely. But one thing to note that I find probably the most difficult with patients is that, we clean a child out and then, we have this continued regimen that we have to do. And if that doesn't happen, we're right back to square one.
Sure.
So soon again. And so it's so important that once you've done a clean out, that the
You're
child
following back up.
Yeah, has
Being in contact.
1 to 2 soft stools every day. And that's
Mhm.
going to require magnesium, or it's going to require Miralax. It's going to require something to help them poop, probably for 6 weeks at least, before you can start weaning them off. Because you really, again, they just, their body doesn't know that they have to poop. They just are naturally going to start holding it again without even realizing it.
And I think it's just like everything in parenthood, like don't let this traumatic event, you think they're going to be scarred for life. No, let's work through this traumatic event. Let's get to a better place and let's keep holding their hand with it so that it isn't this situation where like you think or they think they're never going to overcome it. They will.
No, yeah.
You're going to get through it.
Yeah. And I think too, there's little things I recommend, like you get a little chart or a calendar that you put up on the wall in the bathroom and you get a sticker. It's like, it's a party when you poop. It's exciting. It's a positive.
And you don't have to do it. You don't have to be reward based. It just can be the fact that, hey, we had a poop today.
Mm-hmm.
That's important because we all should be pooping.
Mm-hmm. All right. Have we hit on all things poop for constipation?
I think so. Yeah,
I think that was everything.
That was lovely.
It's exactly what I wanted during our lunch hour today. Well, if you want to find out more about us, you can check us out at fiathealth.org. Obviously, if you're a patient of ours, feel free to send us some love. You listen to the podcast, shoot us a text, and we hope this has been really helpful for you.
Yeah, we will see you next time.
Thanks for listening to this week's episode. To learn more, you can visit our website at fiathealth.org. If you enjoyed this episode and you'd like to help support the podcast, please subscribe to our show on your favorite podcast platform and leave us a review. This helps make the podcast easier to find. Lastly, if you'd like to reach out, ask a question, or suggest a topic for a future show, send us an email at media@fiathealth.org. God bless.